I'm Victor Rodriguez, and I will be presenting my healthcare career project for a registered dietitian. So what is a registered dietitian? A registered dietitian is a nutrition expert. So what does a registered dietitian do? The kinds of things that a registered dietitian does are work with patients, make nutrition plans and programs, connecting those programs to their patients, educating their patients about nutrition and their health, and tracking the progress of their patients. This will help their patients improve their health and lead a healthier lifestyle. So what personal qualities does a dietitian need? Generally, qualities that a dietitian would benefit from having are analytical skills when researching the best plans for their patients, compassion for the patient they are working with. They need to be able to adapt to their patients' different situations, listening and speaking skills as they work with several people all the time, organizational skills when it comes to keeping track of different patients and plans that they have set up. Working conditions. Some dietitians work in commercial or facility kitchens where they prepare nutritious meals for patients. But the majority of dietitians will work in an office making programs and working with their patients, similarly to a doctor and having a 40-hour work week. Some dietitians are also self-employed, so they would work on their own time. Most dietitians, 27% work in hospitals, 11% work for the government, 9% work in outpatient care centers, 8% work in nursing and residential care facilities, and another 8% are self-employed. Training and education. There are 5 main steps to becoming a registered dietitian. The first one would be to get a bachelor's degree, which will soon change to a master's this year in 2024. They also must complete coursework that is approved by the Credential Council for Education in Nutrition and Dietetics of the Academy of Nutrition and Dietetics. Also, a dietetic internship where they can work with different programs at a healthcare facility, community agency, or food service corporation. And they must pass the national registration exam for dietetics, and also they must receive their state license according to the state requirement. So going back, where do the majority of dietitians work? For the government, hospitals, nursing and residential care facilities, or outpatient care centers. So the majority of registered dietitians work in hospitals. Anatomy and physiology. So how does a dietitian relate to anatomy and physiology? So dietitians help to improve body functions with information about foods such as controlling blood sugar levels, vitamin levels, or helping the digestive tract, which are covered in anatomy. What foods have the lowest glycemic index? Vegetables have the lowest glycemic index. The average salary in 2021 was $65,620, with the top 10% making $93,640 or more. Also in 2022, the average salary was $66,450. Job prospects and growth. So between 2022 and 2032, there's a predicted increase of 7% growth compared to the average job that has a growth of 2%. There's an average of 5,600 new job openings per year. Locations. Most employed dietitians and nutritionists work in the east of the United States and major states as shown in the map. Though California has the highest employed nutritionists and dietitians with 9,600, followed by New York with 5,200. Schools. I'll be focusing specifically on California. There are 2 universities with coordinated programs that will lead directly to becoming a dietitian in Loma Linda University and California State University of Los Angeles, where you can earn a Bachelor of Science or a Master of Science degree in nutrition and dietetics.